So nurses very much on the front line of all this. Are they getting the equipment and the training they need for what could possibly about to happen?
Hello, yes, they are. We have very well rehearsed plans for dealing with outbreaks of infections and also new diseases that occur. So the use of personal protective equipment, the implementation of isolation precautions, for example, are very well rehearsed within the NHS.
Right, and do they have enough of this personal protection equipment? There are stories about, running out of masks. These are single-use items. Do they have enough equipment, do you think?
There are in the system supplies that nurses and other healthcare workers need in order to protect themselves. What we're trying to do together with our colleagues in NHS supply chain is to ensure that everybody has the stocks that they need and that we don't overstock in some areas that results in shortages in others. So we're being very careful around the stocks we have. We are training lots of staff to be able to use particularly the special masks that healthcare workers use. So that does mean that it's busier than normal, making sure that staff are well prepared. But there are currently no shortages in terms of the staff that need to use the masks at the moment. They have them.
Yeah, and I mean, it's well known that currently A&E departments all over the country are at full stretch or very stretched. And what about the shortage of nurses? We keep hearing about 40,000 too few nurses. Is that going to be a problem that's going to become acute during this crisis?
As you know, the NHS has been under considerable pressure, and that means that nurses are under pressure as well. But what we can say in relation to this outbreak is that from a nursing perspective, certainly we are very adaptable and flexible and will absolutely step in to support the management of this outbreak.
Yeah, and what about this idea of, retired doctors and nurses coming back? Are they up for that? Are retired nurses who may be 60 plus, who may be in that age group that's supposed to be most vulnerable, are they wanting to come back and work now?
Well, nurses retire at different ages and for different reasons. We are talking about the government's action plan and the potential to bring back retired healthcare workers is very much in the mitigation phase of the action plan. So we're not there yet. And what we're doing at the moment is we're focusing on what we need to do now. However, with the right regulation and with the right safety measures in place, nurses may well step forward and come out of retirement to support their colleagues.
OK, and I mean, there are predictions of a fifth of the workforce becoming ill. Nursing staff and doctors, we're told, could well be affected disproportionately. There are predictions you could lose a third of nurses in a pretty bad case scenario. There's one professor in East Anglia, professor of medicine, saying you could lose half. What do your assumptions, what do they make of that? What are you predicting?
Our predictions will very much be based on what we know from our pandemic planning and our experience with swine flu about 10 years ago. So, for example, we know that if the outbreak spreads, that we will see different waves, and the numbers of people affected during those waves will vary. Healthcare workers obviously will potentially be exposed to the virus in the workplace, but also in the community by that stage. So we will undoubtedly see staff that are off sick, but there will be plans in place to focus healthcare workers where we need them most.
Right, and so this could involve healthcare assistants, for instance, working up as nurses. Is that advisable?
So healthcare workers will continue to practice within their scope of practice as healthcare workers. So we would not be expecting them to take on the role of registered nurses. So the public safety, even when we are stretched in outbreak conditions, is absolutely our key priority. It may also result in pressures in community settings and also in our social care sectors where nurses are working. So we are looking at plans in order to avoid problems there and to also try and keep vulnerable people out of hospital.
OK, Rose Gallagher, appreciate your time. Thank you very much.